What's the real story with joint pain and nightshades?
Oh, okay. So nightshades, like the entire family of plants, have a class of compounds in them called glycoalkaloids. There's a bunch of different ones, but the ones that you're going to get from nightshade vegetables would be solanine, caconine, tomatine. And if you get too much glycoalkaloid, so glycoalkaloid poisoning, one of the symptoms of that is joint pain. Other symptoms would be like dizziness, nausea, vomiting. So that's one of the things that happens when people consume like green potatoes, for example, can cause glycoalkaloid poisoning. That's why if you grow potatoes and they grow too close to the surface and they're all green, then those are best used as seed potatoes for the following year. Every once in a while from the grocery store, you might get very green potatoes, take them back and return them. Like those can have really high glycoalkaloids. And all of the cases of glycoalkaloid poisoning in humans from food, not something like deadly nightshade, all come from stories of people eating very green potatoes. And in that case, as little as a pound of green potatoes can have enough glycoalkaloids for the average sized person to have joint pain and other badness as a side effect of glycoalkaloid poisoning. For tomatoes, for the average sized person, you would need to eat like 300 pounds of tomatoes to be in that level of like glycoalkaloid toxicity and causing symptoms like joint pain. So for most people, like nightshade vegetables are not a thing to worry about. They're not going to cause joint pain. In fact, tomatoes are overall anti-inflammatory. They lower inflammation because they have all these other nutrients, not just glycoalkaloids, that help to lower inflammation. That being said, it does appear from the scientific literature that some people may be more sensitive to glycoalkaloids than others, and that might manifest as increased joint pain eating these vegetables. More studies to understand whether or not this is a, glycoalkaloids like hypersensitivity, or if something else is going on, maybe it's placebo, like maybe like placebo can work for us and against us. You can be attributing symptoms to a food when really that food has nothing to do with those symptoms, right? So that is placebo effect in the bad way. So so yeah, it's definitely more science is needed to fully understand whether or not glycoalkaloid sensitivity is real, whether or not there's like a gene, maybe a gene variant that's responsible. Like all of that is not known. But the beginning part of that myth is that joint pain is one of the symptoms of glycoalkaloid toxicity if you were to accidentally consume something like belladonna.